Hey everybody, a very good evening to one and all, and hope we find this safe and sound, happy and healthy. This is Oryx Doctors presenting you this month as a mental health awareness month. We all be thinking like why this is needed for us Formdians, like the summer is too hard to handle, we are super stressed about the climate, and oftentimes we need ice creams to cool us now and then. But jokes apart, from these students, we really need this mental health awareness program because we are oftentimes intimidated by our family, teachers, friends, oftentimes stating that where are we going to be in future? What is the position we are going to be? And we are not even steady about our career yet so far. So, this is the important event presenting by the ORX doctors stating the mental health awareness programs, and we have an eminent speaker, Dr. Siddhika Iyer, consultant psychiatrist. So, I hope this day will bring you a very good informative session. And we all are had hear about the word stress and depression, anxiety. Often days we use it very commonly. Even a 5-year-old is super stressed about his own stuff like that. So, when I was reading about our speaker today, I came across an article which she wrote in, where she mentioned about stress. We use stress words to about the exam stress, fear, and stuff like that. And she told that in medical terms, stress is our body's response to challenges, and we must equip our bodies and mind to strong face these challenges. And especially it is true for our generation. And when I went to see up to patients who went under craniotomy surgery, both patients were 71 age and one was in 43 years and patients, and the recovery rate was very much higher for the elderly patient and not for the 43-year-old patient. When asked about this to the surgeon, he told that when you practice your mind when you are young to face the oxygen depleting condition, stress condition, your brain will practice to cope during the stress and during certain procedures too. So this is very important for us to practice and make a self-care for us. As we all know, physical, mental, and social behavior is very much important for a very good, healthy living. So we all know what to do, but we do not know how to do. And for that, we have such a good speaker today, Dr. Siddhika Iyer, consultant psychiatrist, Gleneagles Health City, Chennai. And she'll be speaking about the topic self-care and coping strategies for the PharmD students. And she is a consultant psychiatrist and she diagnoses and treats mental and emotional behavioral problems in adults and children. In our society, we know that there is a lack of awareness about psychiatric disorders, and oftentimes there is a stigma about the treatment and the therapy. And she is working towards the awareness of mental health issues and available treatment options. She is interested in social media collaborations and conducting workshops to increase awareness about mental health, and that's why we have her today. Her area of expertise include anxiety disorder, depression, stress and anger management, sleep and eating disorders, alcohol and drug addiction, internet and gaming addiction, schizophrenia, bipolar disorders, women's mental health, consultation with a psychiatrist. And we hope that this day will be a very good session for us. And ma'am, I welcome you to this session. The stage is yours.
Thank you so much, Jennifer. That was a lovely introduction, and thank you for taking the time out to read some articles. And I'm sure that gives you a better understanding of what we face as a mental health professional in day-to-day life, like what we are doing in terms of treating and diagnosing them. So this is going to be just a session where I am talking to you. So I would really love it if you all are comfortable to turn on your cameras so that we can have an face-to-face communication, maintaining our eye contact rather than multitasking or doing something else or just listening and maybe your phone in another hand, that kind of thing. So anyone who is comfortable, please feel free to turn on your cameras so that we can have a face-to-face interaction. Good evening, everyone. As Jennifer has explained, I am Dr. Siddhika Iyer. I work as a consultant psychiatrist in Chennai. Basically, we all have been hearing more and more about mental health nowadays. I'm sure you'll agree that the awareness in terms of mental health has increased a lot, especially after COVID times, where everybody kind of suffered from a little bit of anxiety or health issues or sleep issues. So it became more and more, it became more increasingly needed that everyone should take time out to take care of their mental and emotional health. So, we all over the years have to go through some kind of stress and emotional difficulties at some time or another. So, no one has a life without any kind of stress, just like a breezy life with nothing to worry about. Sometimes we may face situations that we feel they are too tough, they are too unmanageable. I can't handle this situation. I am feeling completely helpless. Sometimes we may say things to ourselves like, why is this happening only to me? And also, we are hit with the other side where we start worrying a lot about our future. Like, what if something bad happens? What if I don't get a job? What if my health is not good? And we start worrying about ourselves or our family members as well. So difficult situations in life, they make us, kind of sit back and think about how am I going to solve this problem? How am I going to actually face this problem, get a solution, and then become stronger, or at least have some awareness about how I can go through my life beyond this. So we can't sit with the stress and constantly feel why has this happened or what if this is going to happen. We have to equip ourselves to find a kind of solution so that we can be physically as well as psychologically healthy. So, what are the things that we can do to take care of ourselves? So, I have about 6 points that I thought I'll just elaborate a little bit, and do feel free to ask in questions. Is the voice audible now? Somebody has mentioned that the voice is not. Anyone can put it in the chat whether I'm audible now.
Yes,
Yeah,
ma'am,
ma'am,
you are
you're
audible,
audible.
ma'am.
All right. So I thought I would, talk about 6 things, and the first one is how to live mindfully in this digital world. So, what do we mean by living mindfully? When we say this term called mindfully, it doesn't mean that we are silent, or we are meditating, or we are aloof from the world. What the term mindfully is that I'm able to focus on what I am doing, how I am feeling completely, with a sense of purpose, that I am able to be completely involved in a particular action. For example, if I am talking to you now, I am able to talk to you without any kind of distraction. If you are listening to me, you are able to do the same thing without something running through your head, like, what is going to be for dinner, or should I go and watch a movie for the weekend. So, learning to be in the moment and observe what are our thoughts and emotions in that moment, that is what we call as living mindfully. So, if everyone can type in the chat box that type yes, if you use your phone first thing in the morning after waking up. How many of us use our phones first thing in the morning after waking up? If you can just type yes if you do, and no if you don't. Yes, so a lot of yeses are coming in. That what we do is we use our phones first thing after waking up, when actually we have to introspect, is it the right thing to do? How can we wake up? Sorry, just one moment. Sorry for the interruption. Yeah, so since a lot of us do seem to be taking our phones out first thing in the morning to see who has messaged or maybe just scroll on social media, right? So, how can we actually spend our mornings which may be more productive and also better for our mental health? One thing we need to realize is mornings are the best time for taking time out for yourself to plan your day and to make sure that you're able to have your day in the way that you have thought of, so that you don't feel that too rushed, and you don't feel too stressed throughout the day. So there is a concept which is called as a slow morning. So when you start off your morning slow, it is not like you have to go for work or you have to go to college and you wake up half an hour before going, just quickly get ready and eat, or maybe while traveling to work, and then reaching over there. Most of the time this becomes a habit, and for many people who have started working from home, this also may be the thing that they wake up and immediately they're on the laptop and they're working without actually spending time with themselves. So taking time out in the morning to wake up at a time where you're able to do some deep breathing exercises, do some stretching exercises, go for a walk, get a very important vitamin D in the form of sunlight. All this is very important for taking care of our mental health. So, when we mean living mindfully, we also mean, taking time out to talk to our friends, talk to our family, maintain eye contact. Often we see that if you go to a restaurant, you will see four or five people sitting together and they may all be on their phone and no one is talking to each other, right? So we have lost the ability to kind of maintain eye contact and talk to each other. We have to rekindle this habit, which ensures that we are improving our attention span, it improves our sleep, and it also reduces the anxiety that we feel throughout the day. So, can anyone type if they have heard this concept of slow morning and whether they have tried it in any way? I can let you type. So, if you've not tried it, then just see, try it out for a week, and you will see a lot of difference. The second thing I want to talk to you about is trying to set some kind of meaningful goals for yourself and working towards it. Now, what do we mean by meaningful, right? So, nowadays, I find that many people just live from day to day. So you have some work today, you're going for it, and then you go to sleep at night, and then the next day, the same kind of routine repeats itself. So there is not much of thinking that we do about, okay, what am I working towards? Right? So it's very important that we work towards our own personal growth, our self improvement, and our professional growth. So, what do we mean by personal growth? So, personal growth could mean in terms of our studies, in terms of looking after our health, in terms of our emotional growth, like how do you want to be as a person, so understanding myself and trying to develop as a person. So self improvement could be learning a new skill or working on one's physical exercise to be fitter. This could be a form of self improvement. And professional growth is, where do I see myself in the future and how can I develop skills so that I reach that place. So everybody needs to find that, okay, what is the goal that I have which is giving me a sense of purpose in my life. Finding one's purpose in life, this is also the third thing that I want to talk about. So sometimes it seems like a very sometimes it seems like a very difficult situation to kind of understand. How do we know what is our purpose? It would be easier if somebody just told me this is what you're supposed to do, rather than trying to find out, because it means that thinking, what am I good at, what am I not good at, and whether I would want to do this forever. So a lot of thought goes into what is my purpose in life. So there is a concept called ikigai, which is given by the Japanese. So, ikigai is a concept where you attempt to find out what is your purpose in life. So, ikigai basically wants you to think about what is it that you love doing. The second thing you need to think about is what is it that you are good at doing. So, what is it that you love and what is it that you're good at. The third is what is it that the world needs, and the fourth is what will ensure that I am financially okay, what gives me money, right? So something which I love, something which I am good at, which the world needs, and which also gives me money, right? So all these things, if they converge together and you feel, yes, this is what I want to be doing, this gives you a sense of purpose. So as a PharmD student, so what do I love? If it is something related to medicine, related to biology, related to research. So, what do I love doing in terms of when I am pursuing a career in PharmD? What am I good at? So, am I good at remembering, biological conditions, which medication is required for what? Am I good at service to people? Am I good at writing? Am I good at research? So, what would I be interested in doing which I like, and also which is my skill set? Along with that, everybody knows that the world needs good health and good medication, so we will never run out of the need for a good education in any field. And what gives me money is, so how do I make sure that I am using my resources to get the finances that I need, so that everything else in terms of our needs, in terms of what we call as our support system, our basic needs of food and shelter, these are satisfied, right? The fourth thing that I want to talk about is to get to ensure that we have a good mental health and emotional growth, is something which we call as a growth mindset. So, anybody can say if they have heard about growth mindset or they have heard of fixed mindset. Please do be interactive in the chat box, because this gives us a lot of idea of what exactly you want to know as well. So, growth mindset is a concept where when I start something, I may not be good at it. So, for example, if I am trying to cook a dish, I may not actually be good at it when I start. But then I tell myself, I'm not actually good at it right now, but with practice, I can keep, right? Sometimes what happens is we start thinking that if we try something, and then what if somebody laughs at me? What if somebody, makes fun of me for not knowing something which may be very simple? So we start off with a mindset that if I'm not good at it, I'm not going to do it. It's too tough for me. I can't try. And because, this is not something that I can do, maybe others will be better at it. So, with a growth mindset, I am ready to learn. I feel less frustrated. I have more growth potential, and I feel happier as well, because I'm not having this pressure on myself that I have to be able to perform this task. It is okay for me to to not know it well and to make mistakes and then to learn from it. So, as we embrace a growth mindset, what we need is something which we call as self compassion and self acceptance for ourselves. So, nowadays, we find that everyone is a little too critical of themselves, too hard on themselves, too much pressure on themselves. I should score these many marks. I should look in a particular way. And, even just putting out a photo on Instagram or Facebook, and then having a set of expectations that I should have so many likes on this picture, or somebody should comment on this picture. So these kind of expectations we already set ourselves, and when it doesn't happen, we bring ourselves down, we get disappointed, we feel upset, and we start evaluating ourselves as not good enough, that I am not worth it. So, a lot of negative self talk that we give ourselves because of this self expectation and pressure. This leads to a lot of, low mood, feeling of depression, feeling of hopelessness that comes up. So, what can we do instead? So, what we do instead is something which we call as a positive self talk or self affirmations. So, this means that telling ourselves that we are allowed to make mistakes. We may not know everything in the first time. We can learn as we are going, right? Giving yourself credit. Many times I ask a person who's feeling very down to tell me that if your friend was having the same problem, what would you do? And they often say, if my friend was having the same problem, I would console them that they don't need to feel so bad, things will get better, and they should try to move on from this problem. But they can't do it themselves. They have higher standards for We have higher standards for ourselves than for others. That means that we are not kind to ourselves. So when we are kind to others, we must also show a bit of kindness to ourselves. So, all this, to live mindfully, to set meaningful goals and find a purpose, to have a growth mindset, and to practice self compassion, all these things are part of a self care. So, setting aside time for self care is very important. Now, anybody can, type in that what do they do for their own self care? What are your hobbies, or how do you ensure that you are feeling mentally healthy? So, self care could mean what we do for ourselves in terms of hobbies, how we are practicing time management, how do we split our time, um, how much time we are making for sleep. Yes, absolutely right. Getting enough sleep is absolutely a form of self care, especially before exams. Nowadays we have evidence that when you sleep well, your hippocampus actually gets some rest, and you actually retain your memory is better. So sleeping well ensures that you even do exams well. So even there is no excuse for being awake the whole night before exams. Making time for friendships, making time for self reflection. So, self reflection means that I assess my own strengths and weaknesses. I assess what are my own thoughts and emotions, and how we react to certain situations. How am I reacting to a situation? How am I behaving in a particular situation? So, reflecting on my behavior, it's not enough to just go through a day and then say, okay, it's over the next day. If some particular stressful situation happened, how did I handle? What could I have done better? And then, if I'm not able to find an answer, can I ask somebody for help? You know, and introspection and ability to make changes. This is what is also important. So, to understand, is this behavior helpful for me? And how can I improve? So only sleep I've got as the answer for hobbies and for self-care. Anybody else apart from sleep? Okay. So basically, there are certain these. I hope that these points are useful for you in order to understand how we can prioritize ourselves for our mental health and self-care. And self care doesn't only mean relaxation, but it also means making time so that we feel better. We have some kind of personal growth, we have a purpose in our life. It's not only relaxing and feeling stress free, but also, empowering ourselves to do better in our lives. So, that is also what self care means. So, but at the same time, we must remember that in general, the world has become more stressful. There are more things that younger people have problems about in terms of managing their own thoughts and emotions. So, if any time there is anyone feeling overwhelmed, do reach out to them. Do ask them, is there anything that you want to talk about? Is there anything which is bothering you? Because when a person is stressed, they may not be able to reach out so easily to another person. And at the same time, if you are feeling stressed or overwhelmed, then make sure that you do connect with someone who's able to understand you. And if no one is available, do reach out to any psychiatrist who will be ready to help you when you are going through difficult times. So it's no longer that we have to feel ashamed if we are not able to manage. It's not a sign of weakness. Anyone can feel depressed, stressed, anxious, afraid at any point in time, and it is okay to ask for help and seek help to become better at that time. Thank you all very much. Yeah, I would like to know if any of you have any questions which we can discuss.
It's a discussion session. Mic is open to everyone. Anyone can ask the doubts. Ma'am, doubt from my side is a request. During exams times, we form the students have continuous exams, and we are a little bit stressed about that as we have when it comes to fifth years like leadership project and academic side, and then we have to do some like courses, and everything is are dumped into us, and we are stressed during the time. So, your tips for us to handle the exam fear and how to cope in those situations.
Yes, definitely. So, one of the biggest anxieties is when there are exams, right? There is always a pressure that I have to perform my best, I have to perform well, and it increases just before the exams as well. So, the tips for this is basically we all know that the end of the year is going to come with an exam. So we need to know that, especially while studying PharmD, some of the things can be very difficult and may need repetition you know, and you may need to prepare well in advance for these things. So make sure that you are planning well in advance and start your preparation early. The more prepared you are, the less anxiety is going to be there before the exams. So even when you are starting your preparation early, see what helps you to study best. So some people study best individually, some people study best in groups, some people study with discussion, some people with writing down. So what is working for you? How can I make the subject matter simple for myself? So this is not possible when you do it in the last minute, right? So start early, your preparation early, and as you are studying, make it easy for yourself by making notes so that you can revise easily. Discuss with friends, have group discussions, because this also helps you to remember things better. And it also helps to study from a concept orientation rather than just learning it up, what we call as mugging it up, without understanding the concept. So try to understand the concept. Say for example, you have a particular drug and it is acting on a particular receptor, so what effects, what side effects, based on which receptor it is acting on. So concept oriented learning will help you to remember, make correlations among two things, and it will make it easier for you to study. So, and along with that, making it in a form of a picture format, like if you have flow charts, diagrams, these things are also easier than just trying to read theory. So start well in advance, make it easier for yourself based on what is the type, how do you remember better. Make sure you get a good night's sleep before the exam, because in the last minute you may not be able to study everything. So whatever you've studied, if you want to remember, that good night, that sleep is really good for you. And make sure that you are not ignoring your health because of the stress. So make sure you're eating well, reaching the exam on time. And even if you feel I'm not able to do well, still try to do the best that you can in the exam time. So don't let it affect your physical health as well.
Thank you, ma'am. Thank you so much.
Yeah, ma'am.
Yeah.
Can you explain about clinical research, ma'am?
Sorry, it's not audible, Lakshmi.
Can you explain about clinical research, ma'am?
Maybe you can type your question. I'm not able to hear.
Hello, ma'am.
Yes. So I have a
I'm
question.
about
Yeah.
how um, like PharmD is a 6 year course now, ma'am. It's a long term course. So how to stay consistent throughout 6 years and how to manage the stress levels, exams, internals, externals, and future careers about career.
Hmm.
So how to manage it, ma'am?
Okay. So basically, even though it is 6 years, I think your portion will be divided, right? What you learn in first year and what you learn in sixth year may be very different. So
Yes,
one day we have to learn to take one day at a time, not like worry about all 6 years as well as what job we are going to get after that. Just see whatever is in your control right now, that is what we can manage right now. Don't think about things which are beyond your control, right? So will I get a job after 6 years? We don't know right now. So, okay, what is the next step? Which subjects do I have right now? How can I prepare best for these subjects? If I don't know, can I take help from some seniors or teachers where I can ask my doubts, where I can, clarify what is it exactly that I want to know. So, keeping an open mind in that way, clarifying your doubts, don't go with a lot of anxiety. Take one step at a time. So, don't think of all 6 years. Just think, okay, what do I need to do in the next 1 month? What do I need to do in the next 1 week? What do I need to do in the next one day? And then start doing it. And overall, after that, the ball will start rolling and you will be able to manage well. So, someone has asked about, yeah, in our inner mind, we may think continuously about even a small problem and how do we overcome this. So, basically, um, problems may be big or small, but when we feel in our mind it is a problem, it's always very valid that even though it is a small thing, if it's troubling me, it's very valid. So then we need to think about, why is even this small problem troubling me? What are my thoughts about why it is troubling me? So a little bit of analysis into why a little problem is so big, because it may have, you may be connecting it to something else. You may be connecting it to something which is very anxiety provoking for you. So trying to analyze it, and why is it that it's a problem, and then trying to find a solution is the way to go forward. Not like, oh, it's a small problem, let me forget about it, because then it becomes big and comes back later. And someone has asked how to overcome the problem of procrastination. So procrastination is very, very common, because I mean, and there may be many reasons. One is, it could be because we are trying to do our best, so we are like, wanting to have the perfect um, response. So that is why now I'm not in the mood, so when I feel better or when I feel good, only then I will start studying. So that could be one reason. One reason could be a fear of making mistakes, that I'm very afraid to make mistakes, so then I should not do it right now, or I'm not capable of doing it. And the third one is because of all the distractions that we had. So we are in our comfort zone, that it's easier to take rest, or it's easier to be on my phone rather than to study or start working. So understand, what is the reason? Am I being distracted? Am I being anxious, or am I being a perfectionist? And then see that, okay, what is the reason I want to start this project and complete it? So make the reason to do the project stronger than the reason to postpone it. And then you'll be able to overcome the inertia. I hope this has answered your questions.
Any other questions? And there is a question from Aditi in the chat section: how to deal with social anxiety?
Okay. So, social anxiety usually means, fear of judgment, like, what are people going to say about me, or even if it means public speaking. So, what if I make a mistake while speaking and then people judge me? So it is a problem which many of us have, and it kind of also limits us from achieving our potential. So when we know that okay, I am suffering from social anxiety, then there are certain mindset change that may be required, which is why exactly is it that you are in that position where you need to talk to people, or maybe you want to do some public speaking. And I often you know uh, tell people that people don't have much time to think about what you are saying and to catch you if you are making mistakes. So we often get stuck into what are they thinking about me, but maybe others are not really judging us so much. Maybe others don't have so much time to actually think about what we are saying or what mistakes we may be making. So just to kind of get over that feeling that maybe I cannot afford to make mistakes. And as we spoke when I was talking about the growth mindset, that the first time I go and I approach maybe a stranger, or if I'm going and talking to a teacher or a senior person, there may be sometimes that I do make a mistake. I may be nervous, so I may be sweating, or I may not, my voice may not be loud enough. So, but the more you do these things, the more the social anxiety comes down, right? So if it is very, very um, if it is very physically debilitating, if it is very like physical symptoms are too much, then we do have medication even to reduce the level of anxiety there is. But otherwise, even a clinical psychologist can um, we have we do a therapy which is called as cognitive behavior therapy, which also helps to reduce social anxiety if it is very severe.
Another question from Sharvari: how to overcome peer pressure?
Right. um, so every individual person is unique, right? It is we cannot compare ourselves to anyone. Like just as we say all five fingers are not same, so everyone has different attributes, different qualities. But at the same time, just as if we have to eat, we need all five fingers. In the same way, the world needs people with all aptitudes and all strengths and weaknesses, right? So more than trying to succumb to peer pressure, it is more important to understand what are my own individual strengths and limitations. So more than comparison, it is self growth. So when you think about self growth and what are your own values and principles, you will not succumb to peer pressure.
And then from Harini: how to set our mind consistently to work?
Okay. So everyone finds it difficult to be consistent, because many times we think that we have to be motivated enough, or we should be enthusiastic enough to start the work that we are doing, right? So if you decide that I want to wake up at 6 o'clock in the morning every day and take a walk, on many days you may not feel like waking up. And on many days, you may feel that if I don't feel like waking up, then why should I force myself? So the decision to wake up cannot be done in the morning, right? It has to be done the previous night. So planning and telling yourself that even if I don't feel like, even if I'm not motivated enough, I will do it at least a little. If not half an hour, I do it for 5 minutes. That's also fine. But over time, that becomes a kind of habit. And many of you may have heard that for a habit to become permanent, it'll take you maybe 3 to 4 weeks. So the more you keep doing it, the more your mind will start working consistently, right? So the first time may not be your best. And there's a very nice graph to explain this. which is just that, if you're very motivated and you do this much work on the first day, then the next day you do this much, the next day you do this much. So your growth is like up and down like this. But even if you do little every day, your growth will be up. So don't think that every day has to be your best. Even if you do little, be consistent and your growth will be up.
Another question from Anand: how to manage the workload?
Yeah. So managing workload, mm, it's I mean, it's a very vague question. So I may not be able to, get exactly what you want from it. But overall, when we generalize all the work that one has to manage in a day, then it is understanding what to prioritize. So, prioritizing the most important things, and keeping a target of a time that when should I do this work, and then minimize distractions. So, make sure that when you have work, you are not getting distracted with your mobile phone or something else. So, then it helps you to finish on time. And one other thing is, if it's too difficult, take help. So divide it among two people or more, and then it's easier on yourself. And if you're not able to finish it, don't compromise on your rest, because once you rest, you are able to perform better the next day.
Thank you so much, ma'am. That was one lovely session, and you made clear everything. It was really helpful for us. And thank you for patiently answering our questions. It was really pleasing for us. Thank you so much, ma'am, for telling us that it's okay to be not okay, and it's okay to be okay. Thank you so much, ma'am.
Thanks a lot.
And I hope that this is really useful for us, fellow people. And this month for as a mental awareness program, even thank you so much for participating. This is RX Doctor signing off. And last but not least, you are loved for who you are and not you want to be. Thank you so much, guys. With that saying being said, thank you so much for joining. We'll see you next time. Good night, everybody.
Thank you.